Ryan Buccafurni from Integrity Rehab, and we're going to talk a little injury prevention, all that kind of stuff. Good morning, Ryan.
How you doing, Sully? Thanks for having me.
Hey,
man.
no problem, man. How's everything going?
Going well. Just getting my son ready for some soccer.
Nice. Yeah, you got to be up early with the kids, right?
That's right, man. That's right.
Yeah, I just wanted to dive into a little bit of rehab type of stuff and get some of your thoughts on, especially now with the high school baseball season in full swing. We've seen in South Jersey a couple of guys with some arm tenderness, some soreness. We saw Mike Vestoria, number one pitcher for the Prep, go down with a shoulder injury. There's been some guys at Holy Spirit dealing with some arm injuries. In your profession, your experience, I know you do a lot of work with high school kids. Is this something normal you see pretty much every spring?
Yeah, for sure. Shoulder injuries. The shoulder is a very complex joint, and when you're throwing itself is a very complex movement, and it involves a lot of things to go right? So anytime you have any imbalances that occur within your shoulder blade, can make you susceptible for injury. Also, these kids nowadays are throwing a ton. They're throwing 12 months out of the year, a lot of them, which increase their risks of injury. Dr. Andrews down in Alabama, he's like the shoulder guru.
Right.
And what he's saying is basically, the young kids, we got to stop them at about 8 months, and if we keep them at 8 months throwing, they have less risk of injury. So that's something that's important as well.
How much of that really falls on, communication between the high school coach and the parent? I mean, a lot of these parents, as you know, they're trying to get their kids as much exposure as they can to try to get them noticed by colleges, and a lot of that involves these travel teams, and like you said, they're playing summer ball, fall ball, doing winter workouts. I think a lot of the high school coaches in the area have a pretty good idea in terms of pitch counts and workload and that kind of thing. But, I guess there needs to be a lot of communication with the parents as well on their end and saying, hey, this is what my kid's doing in the off season.
For sure. Communication's key. And I know the Kerns at Mainland, Jason Downing, Romaine over at Holy Spirit, they monitor their pitchers well. But you're right. You have a kid that's throwing high school ball, then going to go play AAU ball, right? Then go play in the rec league. The parents and all the coaches have to be really, really in sync, knowing how many innings, how many hard innings he threw, how many pitches he threw, how his arms reacting. Is he having soreness in the shoulder, elbow? So communication at that point is probably the most important thing during the season. And then I think the one thing also, Sully, is working the off season. There needs to be more emphasis on strength and conditioning specifically for baseball. It's again, throwing is a very unique skill, and there's specific exercises and strength requirements that an individual needs. So I think that's a huge importance.
Yeah, you know how 16, 17-year-old boys are. They want to do the bicep curls and the benching and all that stuff, and try to look buff and all that stuff. But a lot of that stuff is really detrimental to baseball players, right?
Yeah, it is. And there's, in my facility, we try to mix in the fun stuff, the go muscles with the show muscles to try to teach them fun ways to get the scapular muscles strong, to get the rotator cuff muscles strong, still incorporate a lot of core and legs because it all starts from the ground up, right? You need to be strong, foundationally strong. Will take a lot of stress off your arm. But you're totally right, man. Rotator cuff strengthening is not the most cool thing in the world.
How much do the high school kids not know about leg and core strength in terms of pitchers? There's obviously a lot more information available, but are these kids digesting this information? Are the parents getting this information? Because you see a guy like back in the day, Nolan Ryan. I mean, the guy had legs like tree trunks, and he was never hurt. He was throwing 95 miles an hour when he was 45 years old.
Sure. No, I think. Definitely the knowledge and education is getting better and better and better, and the research is coming out, almost every day, about the correlation between core strength, leg strength, and shoulder injuries. So it's definitely growing, but we need to obviously do a better job. I think as a rehab professional, it's an area that I feel passionate about, and I try to talk to coaches and parents and educate as much as teach them the right exercises, educate the importance of all that, for sure.
What other kind of injuries are pretty common this time of year? Are you dealing with a lot of in-season athletes, or maybe some kids who kind of got banged up a little bit in either the high school wrestling or basketball seasons?
Sure. So basketball, football, you see a lot of knees, ACLs. So a lot of post-op right now. I'm treating in-season. Baseball, again, you see a ton of shoulder, elbow injuries. So again, it kind of goes sport specifics. Different injuries for different sports, but shoulders, elbows with your overhead athletes, a lot of your dynamic sports like lacrosse, soccer, football, we deal a lot with knees and ankles. So a lot of post-op right now from those sports.
Talking with Ryan Buccafurni of Integrity Rehab. Ryan, I wanted to get your thoughts on this. I was actually talking to one of the guys Dr. Sokolsky over there at Jersey Shore Sports Medicine in Ocean City last week about icing and baseball, icing the arm up. And he said there's kind of a lot of discussion nowadays as to, what benefits that really has. As far as I was concerned, I never really iced my arm. I always did a lot of long toss in the off season to strengthen up my arm. Maybe I didn't throw hard enough to have to ice my arm. I don't know. but
no, I'm with you.
What's your thoughts on icing? Does it have value, or is it kind of an antiquated remedy for post game?
I think there's growing research to say it doesn't have the value that we once thought it does. I know pitchers they're creatures of habit. And do I think it's that detrimental that if you ice your arm after a game that it's truly slowing the process? It's the idea that if you're thinking inflammation is a good thing, so you create microinflammation during a game, and then that's the body's way to kind of heal itself. So why are we going to take the inflammation out with ice, right?
Right.
It does have like an analgesic effect, so if you're sore, it could be helpful. Do I think we have to sit there and crank ice on everybody that throws 15, 20 minutes after a game? Absolutely not. I think active recovery, nutrition is probably much more important than sleep after a tough game, pitching on the mound. Those would be probably more important than actually throwing ice on your arm.
How tough is that to get high school kids and young athletes to understand nutrition? I mean, obviously it's a lot easier to go to Wawa and get yourself a cheesesteak sub or whatever, that kind of thing. But how much do these kids understand how important nutrition is to their overall health as an athlete?
Again, I think it's growing, at least a lot better than when I was playing, These kids are smarter. They're on the internet. They're learning. They want to get better. With that said, I'm lucky a lot of times when I'm treating my patients, I have an hour with them 3 times a week, sometimes 2 hours 3 times a week. So I try when I'm with them to kind of educate them on that element. But kids are smarter, man, and coaches are smarter, and it's definitely they're definitely getting better at that and understanding it more, trying to get the edge safely and healthy.
Talking with Ryan Buccafurni of Integrity Rehab. Ryan, I wanted to get your thoughts on something you've been speaking about recently, is the dry needling. What exactly is this, and how beneficial is it?
So it's an awesome technique. It's changed basically the outcomes and the way I've treated patients over the last 6 months for sure. And to correlate it with baseball, right? Pitchers throughout the season inherently lose motion, right? They lose shoulder elevation and they lose internal rotation. And we know that just from repetitively throwing, we know as you lose that motion, you're at higher risk of injury. So it's really important to keep that shoulder mobile throughout the season. But a lot of times what you're doing is you're creating trigger points in the posterior rotator cuff, your lats, your teres major, these muscles just from taking abuse from the throws. So by putting a trigger or dry needle through those trigger points, it's a little monofilament needle. It's similar to an acupuncture type needle. You put it into the spastic or the muscles in spasm, create a little twitch response, and actually get the soft tissue to let go. So you're getting huge mobility gains and desensitizing any painful tissue. Really game changing from the rehab world, especially around here. It's a newer technique and really been real effective for me.
So basically, in layman's term, you're kind of shocking the muscle a little bit to get it to relax, right? Is that kind of?
You got it.
Okay.
You're putting the needle right into a muscle that's in spasm. You'll feel a twitch, and the muscle lets go, and you actually see the muscle relax right then. Versus sitting there 20 minutes doing lacrosse ball massage or foam rolling, we can get directly to the tissue and get bigger gains quicker, which I'm a big fan of, and my patients generally are.
I might have to try this stuff out.
Come in, man.
What? How much? Any pain involved? How big is the needle? I mean, this could be scary to a lot of people.
It is. It's a very small monofilament needle, so it's not a hypodermic needle. It's very small. When I put it in, sometimes you'll feel a small pinch, and then when the muscle actually gets released, you'll feel like a cramping feeling. I haven't had anybody, like, you'll get sore. You know, if you're afraid of needles, it's definitely not for you, but it's something that's like you're going to be in tears, like yelling at me or anything. You usually get some significant relief within a couple hours. So usually, texting me like, thanks, man. That was cool.
Now, you're a pretty athletic guy. Have you had any of that done on yourself?
Oh, all over. My shoulder, my lats, my calves. I swear by it. I love it.
So you're walking around like Gumby then, right?
Exactly. You got it, man.
What is the normal reaction of some of the people that have this done, and do they keep coming back? How often can somebody do it? What's the process of it?
So you can get it. It's just part of the treatment plan. So we're still going to do your corrective exercises, get you stronger, get you more mobile, depending on what your needs are. This is just a component of it. So I think 90 to 95% of my patients get a pain relief off of one session, and or a mobility gain, because that's what we're looking for. Mm-hmm. And then it can range anywhere from generally 1 to 3 sessions. If it's a chronic issue, like if I've had people with chronic back pain that have trigger points all along their paraspinals and in their glutes, I've needled people up to like 7, 8 times, just to keep getting the carryover. A lot of it comes with, how much, after we get the soft tissue to release, are you doing the right exercise? Are you doing the right things throughout life to keep that tissue, doing what it's supposed to do and not tighten it back up?
Gotcha. Good stuff, Ryan. We're up against the break, but before we go, if people want to find out more about the dry needling or anything you do, how can they get in touch with you?
Integrity PT Wellness over in Northfield, Tilton Road. It's 241-6339 is the office. Come in, stop in for a consultation. Call if you have questions. I'll be happy to talk to any of you.
Right over there by the movie theater.
You got it.
All right. Good stuff, Ryan. Appreciate you taking a few minutes, and we'll catch up to you soon.
Thanks, Ollie. Take care.
All right, have fun at soccer, man.
Thank you.
All right, that was Ryan Buccafurni of Integrity Rehab.